Welcome to the Homegrown Heart Podcast every Friday morning at 7 a.m. Mountain Standard Time with your host, Dr. Amanada Ryan, DO, MBA, interventional cardiologist, and an expert in her field. This week's topic, meet Raymond Franco, a patient living with PAD. Right now, welcome our host, Dr. Amanada Ryan.
Good morning, Carlsbad, Eddy, and surrounding counties. It is the end of Peripheral Arterial Disease Awareness Month in September, and so we're continuing our series on PAD, again, primarily discussing blockages in the legs. We have with us today Mr. Raymond Franco, a long-term patient of mine. Raymond, thanks for being with us.
Thank you.
And we're going to talk a little bit about peripheral arterial disease in your specific case, as well as coronary artery disease, and other risk factors that you've had. So tell me a little bit about your heart and leg journey.
My heart and leg journey?
Yeah.
So far it's doing good ever since you did that surgery on me. That was beautiful.
And what did
I've been feeling a lot better.
Good, good. So tell me again, about 5 years ago, you had open heart surgery?
Yes.
And how did you get to a point where you needed open heart surgery? Do you remember what was going on? What happened?
All I know is that my blood pressure went up pretty high and all that. And I think it was at 200. So my wife took me over to the emergency room and everything, and they tried to lower down my blood pressure and everything. And they had to use some kind of paddles on me to stop my heart and try to get the heart to slow down because it was beating too fast.
Reset. Yep, you were having.
So that's something that they did do. So after that, they recommended me to you to see you, and I guess after a while, you said that my arteries were plugged up.
Right. We did an angiogram, went through your wrist, right, and we kind of took a look and saw what was going on. Showed pretty significant blockages.
So after that, you said, well, Ray, it looks like we're going to have to put some stents in you. So you tried that and said that after trying to do surgery, you said, well, there's nothing we can do. Your arteries are plugged up pretty bad. We're going to have to fly over to Lubbock and had a procedure done.
Yes. How long did it take you to recover from open heart surgery?
About 3 weeks.
About 3 weeks.
Yeah, after they busted my chest open and all that.
How did it feel? Do you remember how it felt that first few days?
Pretty sore.
Pretty sore, yeah.
But after that, I got up and walk and try to keep the blood circulating. You got to do that.
Definitely.
After any surgery,
definitely.
You want to walk. That's your best exercise.
Completely. And if there's one thing I've said this month, that's been very important too, is that all the fancy procedures we can do, cleaning out arteries, getting that plaque out, you got to do your part. And there's two major things that are quote unquote your parts in your instance. What do you think besides the exercise, which we'll talk a little bit about what you've done specifically there. What else did you do you think made a difference?
Well, that's the food we eat. That's the number one thing, was what we eat, what we put into our system.
Definitely.
Grease and all that, you have to do away with a lot of that.
How much have you changed your diet?
Quite a bit. I had to. I had no choice because I'm also a diabetic too.
Exactly.
So type 2. So things like that happen,
Exactly. So controlling your sugars. Do you know what your A1C has been recently?
Well, right now it's at about 7 something.
Good. Yeah, and you're watching your sugar, your carbohydrate intake, you're watching your grease, your cholesterol numbers, all of those things.
Yeah.
How about smoking? Tell me how long and how much did you smoke?
I used to smoke for years.
And about how much?
Almost 2 packs a day.
And
that's one thing that did it, I think, and I hate it. I wish I never ever done that. That ruined my whole life right there, smoking. So anybody that smokes, I recommend them not to smoke.
Definitely. I talked last week about the New Mexico Quit Line and some of the resources that are there and how we kind of underutilize that. And I have a lot of patients. I think a lot of times some people take 6 or 7 times of trying to quit before they successfully quit. I talk a lot about how it's the mental addiction to cigarettes is really more of an issue than the physical addiction. It's kind of like I smoke after I drink coffee or I smoke after I eat, those sort of things. What do you think was the hard? When did you quit? What was the straw that really convinced you?
Well, I quit after I had this heart procedure. done.
Yeah.
And it was either that or my life.
I mean,
I even drank beer. I would drink a 6-pack, and that's how I got my diabetes.
exactly,
Was it
pure
salt?
sugar. And I think that's a great point, right? You know, I think that's something that people kind of forget. They're like, oh, I don't eat bad. And I've told you, were you ever very heavy? Was weight too much of an issue for you? I know you got pretty thin.
Actually, I was heavy.
Were?
Yeah, I was real heavy, and then I lost all this weight.
Do you think
know.
some of that was alcohol, was the beer and diet, or a little bit of both?
Well, a lot of both, but the thing, exercising is what did it to me. That's what calmed me down from smoking and drinking. I focused my mind on something else.
Mm-hmm.
That's how you quit smoking and drinking. You can do everything if you want to. Just put your mind focused on something
Yeah,
else.
you are a stellar example of somebody that had a serious procedure and said, I'm going to do different. But believe it or not, a lot of people don't do that. I mean, it's one thing even to push primary prevention, which means let me try to get you to stop those things before you even have a problem. That's one area. But then we've, you know, people in your category, what we would call secondary prevention, right? You had the episode, you had a major heart procedure, open heart surgery, they put bypasses on your vessels, and yet they still don't change anything. And sometimes I'm just like, you know, something has to wake you up. And there are so many excuses that I hear from people every day. I mean, it is hard. I don't have money to eat healthy. I don't have money to go to a gym. I've smoked for 30 years. Everyone in my family drinks alcohol. I mean, these are the things I hear every day. And I'm like, I understand, but at the same time, your life is literally on the line. We may not be able to fix you the next time. That's what I always tell us. You know, so what age were you when you had your open heart? What, 5 years ago?
About 5 years. I'd say probably in my 60s, maybe.
Early
Or
60s.
maybe 50.
Yeah, and even late 50s. Yeah, so I don't know how long you live if you don't make any changes. You know what I mean? I don't know how many acute blood pressures of 220 and, you know, A1Cs of 11. I don't know how long we really get through some of that.
Well,
so,
you seen how high my blood pressure was?
very.
It was what, 200 and
Yeah.
something? Then
So since that time, tell me then on the exercise regimen, what do you do on a regular basis with exercise?
well, you could either walk or you could ride a bicycle. I think a bicycle is the best thing for
Mm-hmm.
exercising.
How far do you ride your bicycle? People might have seen you around town here in Carlsbad.
I don't know, probably about 10 miles a day.
10 miles a day.
Yeah, from
And
Lake
I see
Street
you when I'm walking.
all the way
I'm-
this area and all the way to Dollar Tree and back.
Great.
Back home, but the riverside, you know, the park, everything, every day.
Yeah, and I walk out at the beach. A lot of times I'll see you
I'll
out there
see.
riding your bike and stuff. So that's great. And just makes my heart feel good that you have really taken that to heart. But now switching to peripheral arterial disease, which again, the biggest risk factors for getting blockages in your legs, like I told you that day in the office, you were kind of disappointed whenever we found out you did have them, was smoking and diabetes. Right? So you did have those things, even though you quit so it's been 5-6 years you quit smoking and you've been actively exercising that whole time. But tell me what started happening with your legs about 6 months ago.
Well, actually, you start getting cramps in your legs.
Mm-hmm.
And I mean, when you're sleeping and all that's when the cramps happen.
Mm-hmm.
That's when you
Pretty
notice it,
intense.
and they'll wake you up too.
So then, yeah. So then what did we do to check this out, right? You were telling us you were getting cramps in your legs.
Yeah, you told me to come by and we're going to check your arteries out and all that stuff. So that's exactly what you did.
Right. So similar to the
So-
heart cath, right? We went through your
So
wrist.
You
Yeah.
stuck something down my arm and all that, a catheter, and went through my whole body all the way to, I guess, to both legs.
Yes.
The
Yes.
left and the right.
And what did we see when we did that?
Well, you seen blockage. And the
Pretty
left leg, I think you said one of them had tar in it.
Yeah, yeah, a lot of plaque in there and blockages, 90 to 100% pretty tight. So even though, and probably you didn't get symptomatic until now because you stopped smoking and you're controlling your sugars and you're riding a bike 10 miles a day. But to think even for 5 years you've been doing that you still got blockages, you were a little disappointed, don't you think?
Yes, I was real disappointed.
Just kind of feel like I did all this and I'm still having problems. But like we kind of talked about, that stuff's probably been there for a while.
Yeah,
And
that's true.
we did never really looked at your legs necessarily. And this is a good point for the audience too, to realize that, people that have coronary artery disease get peripheral artery disease, and people that have peripheral artery disease get coronary artery disease. Common sense would tell us that plaque doesn't just develop within one place or another place. When cholesterol and tobacco, when it's going to plug up an artery, excess sugar, glucose, when they're going to plug up an artery, they kind of can do it in multiple places, right? Not just one place. So if it could get your heart that blocked up, it didn't really shock us that it could get your legs that blocked up. Although it was disappointing because, you had done what you needed to do. However, the procedures have gotten in some ways more minor in the sense of we used to do open bypasses on leg blockages like yours too. We used to have to take synthetic veins or other grafts and go from where your leg isn't blocked to down below the blockage. But why don't you describe as best you can, what did we do in your case?
Well, actually, it was beautiful the way you did it. Your technology's really changed and everything.
Yes.
You did the procedure there at the office, everything. I guess through the groin area.
Yeah, we went through the groin area.
And after the surgery, after she did the surgery, everything was good. And within 3-4 hours, I was out of the office and walking.
Yes.
Like if nothing even happened.
Yeah, it's really amazing. I mean, I agree. Technology is. So we kind of did one leg at a time. We worked on one leg so far, and we're going to work on the other. Does the leg we worked on feel better?
Oh yeah, I haven't had any problems.
Less cramps, and that's going good.
Yeah, I haven't had any. It's been doing good. So
How about taking your medications? Does it frustrate you to have to take medications when you feel like you're doing what you need to do, or you just kind of accept it as part of the situation, or how do you feel about your medicines?
If it's working, keep up with it.
Yes.
The medication.
Yes.
I don't have any choice.
Yeah.
But other than that, I do whatever you tell me to do. You're my doctor, so.
Do you trust me?
Yeah, I trust you very much. In fact, I'm blessed.
Thank you.
To have you as my doctor.
How about my team? How about the office? How do you feel when you go to the office?
Oh, they treat you really good and everything, like if you're at home and everything. Your mama and everything.
Yeah, it's pretty amazing to have my mom as part of the team.
Beautiful staff. I mean, they work together with her and everything. They do a wonderful job.
What did you think of the surgical center and your experience there?
Oh, it's pretty neat.
Compared to a hospital, and not that there's anything wrong with a hospital setting, but for this elective, you needed to be done, but it wasn't an emergency. I think we're kind of figuring out that the hospital's for emergencies a lot of times, and if we're not in an emergency situation, that we can do quite a bit as an outpatient. So what was your experience like at our surgical center?
I'll be honest about it. This woman's a miracle. I mean, I've been blessed to have her as my doctor, really. She takes care of me, and like I say, whatever she wants me to do, but she's the best doctor around.
Thank
she
you,
really
Ray.
Is.
I appreciate that.
I'm really blessed to have you as my doctor.
And your patients are, there's all the marketing in the world. The only real marketing you need is your patients. If you take good care of people, it's genuine. Danny's heard it several times, and so is anyone watching the podcast. My grandpa was a significant heart patient. I told him I'd be a cardiologist. I told him I would work in a small town and I would get relationships with people and I would help them not have to go to the big city for every procedure they had to do. And God blessed me with a real opportunity out here to do that. So
well, I wish my dad was around, to do this procedure, because, it runs in our family, the heart. I think he would have lived a lot longer.
Might have made a difference.
Had you been around.
And technology, too. When did your dad die? How old was he?
I don't know. I think in his 70s, 80s.
But he had an event quite a bit early.
Yeah.
Same as my grandpa had his first heart
He
attack
had
in his
bypass
30s.
surgeries and all that, but
Yeah.
technology wasn't as good as it is now.
Exactly. Things have really progressed,
That's what I told my sister on the phone. I said, man, you got to see my doctor. Boy, she does wonders.
Yeah,
you wouldn't believe. I said, she's so good, she could do it blindfolded.
I'm still looking at least a little bit, I have that $100,000 monitor up there, right, where I can see what's going on, But I agree. I think it's less daunting to do the procedure in a controlled environment with staff. And I think that some of our staff work on both sides. You've met them over on the office side, and then you see them there for your procedure. I think there's just some comfort in that, kind of knowing the staff.
The thing is, you let them know, and you're comfortable. You don't feel scared or nothing. You just go on with the procedures, whatever you're going to do, and you feel a lot better.
Yeah, because procedures have risks, right? And we have to talk to. We say we could have bleeding, we could have an infection. I mean, procedures have risks, and we got to talk about that. But I think whenever you know the people and they've taken time to get to know you, which I think we really do with our patients, I think it makes a noticeable difference.
Yeah, and like I say, I'm really blessed to have you as my doctor.
Well, we're blessed to have patients like you. Honestly, Ray, if everybody, you are like the poster child for what to do when you have heart disease, when you're diabetic, when you're doing everything you need to do. But it's also, again, I think to show, it's kind of like being on a weight loss journey and you feel like you're doing everything you need to do. You'll get there eventually, but sometimes it isn't fast enough. Sometimes, like I wish you did all the right things and you never had gotten any blockage in your legs. But I do think you will not get a recurrent problem with blockage in your legs, the same as your heart. Those bypasses have stayed open, you've been doing well, and I think the legs will be exactly the same. And I think the biggest reason is going to be you don't smoke, you control your sugars, and you exercise. I mean, right on the table, you were asking me, when can I ride my bike? How long do I have to wait? I'm like, give it a couple days just to make sure I'm sure you're back on the bike now.
Yeah, I'm back on the bike.
Yes. Which even when you have a procedure through your leg, that's fine. Just going to wait a couple days and make sure everything is okay. But I do think you're going to do well in the long term because you do everything that you need to do. You also take your medications. You keep a relationship with your doctor. I think you understand, we talked a lot about our foundation is Partners in Heart Health. And we say we didn't pick that name by accident, partners. Like I can tell you whatever I want, I can stand on a pulpit and preach health and say you have to take this medicine and you can't do this and you can't do that. You've got to want to do it. But at the end of the day, I'm not at your house. I'm not there telling you, watching you, whether you smoke or whether you don't. You've got to take some accountability, and you completely have. But, believe it or not, a lot of patients don't really want to take accountability for their health.
Well, the one advice I can give you is that the best thing to do is it's your body. And what you do to your body, if you don't take care of it, nobody else will.
Agreed.
That's the only words I can tell anybody.
I totally agree.
How they want to take care of their body. A doctor can only do so much, and that's it. But if you don't take care of your body, that's up to you. You can drink, smoke, do whatever you want. Even if you have heart problems, you're doing no good.
Yeah, agree.
It's no good.
Well, I'm totally with peripheral arterial disease. Sometimes patients come in like, oh, I had 18 procedures to my legs. Those doctors just kept wanting to bill and all that. No, I tell people, I promise. I don't even really want to have to do the procedure once, but I'll do it once because people have problems. They have blockages, and I want to fix them. But I don't want it to happen again. I want you to do everything that I recommend, just like you have, and I hope that we do not have another problem. First of all, I don't know that it will ever stomp out all heart disease and peripheral arterial disease. And as I've stated before, if we did, I'll do hair and makeup. I have other interests, So people say, well, doctors kind of want us just to keep having problems so they can have something to do. That's not true. So thank you for coming in today, Ray.
Well,
You've been a great guest.
I'm honored to come here.
Yeah.
I really am. I'm blessed.
You've been a great guest. I think people are really, your opinions and your experience really going to resonate with people. You're relatable. And I think you're going to change some people's lives. I really do. So I hope you realize how important your story, your willingness to share it, and your journey really is.
Yeah.
Because I want somebody to see you and say, Ray made the changes, I can make the changes.
It's easy. You can do it.
Mind over matter.
That's right.
Excellent. Well, thank you.
Thank you.
It's been a great month in September. I also am going to do a little bit in the future. I talked to Dr. Barron's office. I've talked a little bit about Dr. Barron, but I talked to Brittany Rhodes, her nurse practitioner, who's a specialist in aortic disease. Aortic Awareness Month is also September. So we did a lot of PAD things, and I'm going to do a little bit of aortic awareness and have them as a guest as well. So we'll be setting that up here in the near future, so you'll definitely want to learn about that again. Summer Gonzalez from our own team and her family are affected by aortic disease. So it's been a great month. We've had so many different screenings. We have one more in Roswell next Wednesday at the Senior Center there. We've had very successful ones at the Senior Center in Hobbs this week and Artesia last week at our own facility in Carlsbad to start the month. So I hope everyone has really gained some knowledge about peripheral arterial disease. what causes these blockages and what can we really do about them. Ray is such a great guest. Again, talk about somebody that really took heed to having premature coronary artery disease and made the decision to extend his life and wanted a good quality of life. I've talked about walking the beach, and there is a beach here in Carlsbad for my Florida people. It has, a 5 granules of sand, but it's still a beach. So that being said, I've talked about walking the beach and getting the motivation to do so sometimes, and sitting in my car. But I've been sitting out there in my car before trying to get the motivation to really walk, and Mr. Franco rides by on his bicycle, and I think to myself, yes, Amanda, get out of the car and walk. You set an example, he sets an example, and you got to do it. So again, there's a specific program for PAD patients called SET therapy, SET. Again, it's really a structured exercise program. Not everybody's going to be able to start that has significant peripheral arterial disease of riding their bike 10 miles a day. And he probably delayed really having symptoms in his legs and needing these procedures done, where we quote unquote roto-rootered out with these fancy atherectomy devices, because he was being so active. But many of our patients that have wounds on their feet and have 100% blockages throughout their entire thigh arteries, these patients may, walking 3 minutes might be what they can do. We are there to partner with you in your health to truly get you as functional as possible. But you 100% have to do your part. And if there's an overwhelming lesson from this month, again, I feel like a walking public service announcement sometimes during September. Heart Health Month is going to be in February. By the way, that's always a big deal for Advanced Heart and Vascular Center of New Mexico. And we're going to Partners in Heart Health. We have all kinds of different things planned. This Saturday, we have a Heart Walk, Heart Healthy event going on in Hobbs. We have 130 people signed up, I think, so far, which is great. We want our heart warriors to know, our peripheral arterial disease warriors to know that nobody walks alone. We care about you, we care about your health, and we are on a mission to change the cardiovascular health care in Southeast New Mexico. And we've been here a long time serving that mission, and we'll be here for a long time to come. So thank you for your attention today and every day. Please share with your friends, let them know to subscribe. The more people we can reach, the bigger difference we can make. And that's truly why we're here. So thank you for your attention and have a great week.